On September 11th, Liberty and her sister were walking a friend home from school. It was about 6 o'clock in the afternoon. They had to be in by 7, so they were walking her home, and the sister and the friend crossed the street. Something made Liberty stop, and when she looked up, she saw a car coming from the right-hand side, so she waited for that car to pass. When it passed, she ran out. At that point, there was a car coming from the left, so she was struck at 40 miles an hour.
She had had a pretty severe injury. She had difficulty breathing. She had a tracheostomy tube. She was really not moving at all at that point.
She was on life support for 28 days. She wasn't able to talk to me until October 10th, when she was able to cover her trach and tell me she loved me, which was amazing.
Liberty came to rehab after a long ICU stay. She was still on the ventilator for short periods and had a trach. She was very angry about her whole situation, and it was tough to get her motivated in the beginning. We really had to slowly work on just getting her out of bed and being strong enough to sit in a wheelchair. And it was just tough because she did not have any movement below the chest level, movement or a lot of feeling. So she really had to work on figuring out how to move her body. So in therapy, the first step was making sure we had a chair for her. And once she figured out how to drive her power chair, that was pretty much the end of her sadness, and her whole attitude turned around.
Well, I liked it because all the people were so nice and they helped me get better at coming out of myself.
You know, when she started to eat, they would bring her anything she wanted to eat just so she would eat. You know, they brought her strawberries for days. That's all she wanted.
Then I went to fried chicken. I'm on a cereal box because I'm the Children's Miracle Note champion.
We have a celebration called Friday Finale. Every Friday, everybody comes together in the gym.
We talked about what we've accomplished over the week.
And what they want to accomplish next week. And sometimes it's even like a little talent show. And really neat celebration of everybody's accomplishments.
What's really amazing about Carolina's healthcare system is that for children like Liberty, they have a nice continuum of care as far as coming into the ICU in this very, very difficult time. They can transition to, say, another floor in Levine's, then come to us for rehab, but it's really great that we can continue to follow their care as far as when they continue to the home setting and as well as to outpatient services. It's just nice to have that continuum all within the same system.
We're lucky enough here to have some very cutting-edge technology.
Children's Miracle Network has been awesome, especially this past year. We just received the donation for what's called a functional electrical stimulation cycle.
And that is a form of a kind of like an exercise bicycle. The patient's muscles are hooked up to electrodes that stimulate the muscle in conjunction with the movement of the bike. It's a way for somebody who isn't able to move on their own to be able to get exercise. The prognosis is still a little bit hard to say at this point, but we're seeing some really encouraging things from Liberty. If you look at where she is now compared to where she was initially, you know, she's able to get around in the wheelchair really well. And there's a lot of research being done right now on, you know, different treatments to restore mobility and function for individuals with spinal cord injury. And so who knows what the future is going to hold.
I'm so grateful that this hospital was here because I'm not sure that another hospital could have done what they were able to do for my daughter. So they saved her life.
I love you, Mom.